Over 10 years after ACL reconstruction, what is more likely, graft failure or tearing the ACL in the other knee? Welcome to the Sunday Paper Roundup, where I read the paper so you don't have to. I'm in my moss green figs, and this week's paper is from the Journal of Issakhos. One of the authors is Umar Butt from Pakistan, alongside colleagues from Karolinska and Milan, and looks at a question every ACL surgeon, physio and patient should care about. This was a systematic review and meta-analysis of long-term outcomes after primary ACL reconstruction. The authors included 18 studies with over 5,700 patients and mean follow-up of just over 10 years. So it gives us a useful long-term view of re-injury risk. What did they find? The pooled rate of graft re-rupture was 11%. The rate of contralateral ACL injury was 12%. There was no statistically significant difference between them. So the key message is this. The risk of tearing the other ACL is basically as important as the risk of tearing the graft. And that matters because too often we focus only on protecting the reconstructed knee. So what increased risk? Two things stood out most clearly. First, younger age. Patients under 18 had a significantly higher risk of graft rupture and also a higher risk of contralateral injury. Second, hamstring grafts. Across 5 studies comparing hamstring and patella tendon grafts, hamstring grafts had a higher graft failure risk. And there were also narrative signals around return to pivoting sports, higher activity level, knee laxity, increased posterior tibial slope, and soccer in particular, or football, as a higher risk exposure. One interesting point, delaying return to sport to 12 months or more did not significantly reduce overall re-injury rates in the data they analysed. And that doesn't mean that time doesn't matter. It means time alone is a poor risk management strategy, which fits what many of us already believe. Return to sport should not be based on the calendar alone. There are some real strengths of this paper, the main one being the long-term follow-up. Second ACL injuries don't stop at 2 years, so looking at a decade of outcomes is really valuable. It was also a clinically relevant question. Graft versus contralateral leg injury risk is exactly how patients should be counselled. There was a large pooled sample, almost 6,000 patients, and there's useful subgroup work on age, graft type, failure definition and follow-up duration. But there are some important limitations. There was high heterogeneity, meaning the studies were quite different. Definitions of graft failure varied and return to sport data were inconsistent, so the exact numbers should be interpreted cautiously. What does it mean clinically? Well, for me, it reinforces 4 things. Firstly, second ACL injury risk remains substantial long-term, and so the other knee deserves as much attention as the reconstructed one. Young athletes are a generally high-risk group, and hamstring grafts appear to carry a higher long-term graft failure risk than patella tendon in the evidence included here. Now, I'm mindful of the evidence that's come out from the Lyon group with excellent data for hamstrings. So to be clear, I'm analysing what this paper showed, not all of the literature on hamstring ACL reconstruction. And importantly, time alone is not enough for return to sport decision making. So what's my verdict? Should you ignore it? Should you be aware of it? Should you consider it? Or should you go right ahead and change your practice? Well, my verdict is be aware of it and keep it in mind when you see patients. It reinforces something we probably already suspected, but it's useful data to support that conversation. Stay tuned. I'll see you next Sunday. I'll keep breaking down the evidence as it lands.